But let's move on to the US, where President Biden has told intelligence agencies they need to redouble their efforts to investigate the origins of the virus. China has warned against politicising any attempt to find out how the virus first emerged. Mr. Biden's order highlights just how little we really do know about where the virus came from. Let's tell you what we do know. In early 2020, Chinese officials said that the outbreak had begun at a Wuhan market, blaming illegal wildlife sales, although that theory is contested. The presence of a virology lab in Wuhan led some to suggest that the virus was man-made or had accidentally escaped. In March, a joint WHO and Chinese report dismissed the possibility of a lab leak as extremely unlikely. Instead, it concluded that transmission from an animal to a human was much more likely. But there has been so much criticism of this report. The director of the US National Institute of Health, who told senators on Wednesday, we cannot exclude the possibility of some kind of lab accident. Let's join Professor Dale Fisher, who is an infectious disease expert from the National University Hospital in Singapore. Good to see you again, Professor Fisher. We've got China coming out today saying don't politicise this. But what do you make of the momentum behind this issue right now, and President Biden saying, look, there's 90 days to investigate more closely the origins of the virus?
So thanks for having me back. It's all come about, I think, because of this Wall Street Journal article, which is referencing some US intelligence that 3 workers from the Wuhan Institute of Virology went to hospital a month or so before the outbreak started. If that's true, I don't know it's true, but if it's true, that would be disappointing, because this would be the sort of evidence that you'd like to have thought would have been made public by now. If you're wondering if there was a lab outbreak, then to actually disprove it, the best ways to do it are to show that you're not working on a virus that we now know as SARS-CoV-2, and also to show that no one has gotten sick. There's been no clusters. So this would be the sort of evidence. So as I say, if it's true that there were people that had an illness compatible with COVID, then it's a pity this wasn't disclosed. But as I say, we don't know that. They could have gone there for a completely different reason. Do
you believe, Professor Fisher, that we will ever have a definite answer on the origins of the virus?
So where we are now is that the current hypotheses, the WHO work group came up with 4, but there's really little evidence making any of them stronger than the other. As you mentioned, the evidence for the lab really is that there is a lab. There's nothing else particularly stronger about that, and the evidence about a more natural species jump is that this is how it's happened for centuries, especially over the last 40 or 50 years, that viruses mutate and they jump species, and we just haven't found that link yet. So will we ever get there? I'm not sure we're going to get there the way we're going. There is a lot of research still happening. I think we do need to be a bit patient, but we also need to be diplomatic. We can't do this without support from China. It needs to be a no-blame environment. You never get to the bottom of an outbreak if your opening line is, you know, if this is your fault, you're in big trouble. So, and that'll be the same with any country. So there needs to be a strong diplomatic and no-blame approach to everything we do, and to still go through the science.
Do you think, though, that WHO report dismissed the lab theory too quickly? Only 4 of the 313 pages of the report actually address the possibility.
I think it was a considered opinion of the available evidence. They didn't find any more evidence for a lab leak. As I said, the main evidence for it being a lab leak is that there is a lab. So I think probably they could have couched it a bit more politically appropriate, because it was a very sensitive issue, and to apparently dismiss it probably wasn't the right thing to do. But no, I don't think they have intentionally gone to hide it. It's more just there probably wasn't much to say about it.
Professor Dale Fisher, always good to have you with us. Thanks for joining us from Singapore. And just briefly to tell you, the WHO is not making a new comment today on this, but has said they are reviewing the recommendations from the Virus Origin Studies report at a technical level.